Welcome to the Philips HeartStart FRX defibrillator demonstration. The Philips HeartStart FRX is designed to be an easy-to-use, rugged, and reliable automated external defibrillator, designed specifically for those who get there first. This demonstration illustrates the functionality of the HeartStart FRX, including easy-to-follow voice instructions and descriptive visual icons that take you through each step of the process. To start the defibrillator, press the green on-off button and follow the HeartStart FRX's voice instructions.
Remove clothes from patient's chest. When patient's chest is bare, open gray plastic case and peel off white adhesive pads. Look carefully at the pictures on the white adhesive pads. Peel one white pad from the gray case. Place pad exactly as shown. Press firmly to bare skin. When the first pad is in place, peel the second pad. Place pad exactly as shown. Press firmly to bare skin. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now.
As soon as the pads are in place, the AED will immediately start to evaluate the heart rhythm.
Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm.
Make sure no one is touching the patient.
Shock advised. Stay clear of patient. Press the flashing orange button now. Press the flashing orange button now. Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions. Keep time with the beat.
CPR should continue to be performed according to standard protocol.
Continue CPR until the AED tells you to stop, emergency medical personnel arrive, or the person starts moving. While you perform CPR, the AED will interrupt you at regular intervals so it can check if another shock is necessary.
Stop CPR. No one should touch the patient. Analyzing.
Keep standing clear of patient while the AED is evaluating the patient. It may decide to shock again, or it may say,
Shock not advised. It is safe to touch the patient. If needed, begin CPR.
Even if they start to move or breathe normally, do not take the pads off the patient. The AED will keep monitoring the patient and will tell you if another shock is needed. That's it. Just do what the AED tells you from the moment you turn it on. When the emergency medical team arrives, you may have saved critical time by starting treatment. Even better, you may have saved a life.
Okay, now we're going to go over the fast response kit. If you purchase this, it has several items in it that you will find very handy if you do have an event where you have to use an AED. And normally this is going to stay attached to the top of your AED. It will simply sit in a case like such. I'm going to take it off for demonstration purposes so I can go over what's in the unit. And as I go over this, I'm also going to talk about some special considerations that you need to keep in mind when using an AED. So we'll cover those at the same time as we're going through what's in your fast response kit. So if we open this up, I'm going to go ahead and take the contents out, and I'll go through each part separately. So the first thing you see is there's another pair of scissors. If you remember, there was one pair of scissors that's in the lid. You have another pair in your fast response kit. Again, these are for cutting clothes, so we would come right up the center of the chest. All of the clothing needs to get out of the way to use an AED. And that includes any type of undergarments need to be cut. These scissors will cut through any clothes. You don't have to get it out from under them, but just make sure that the front of the chest is bare. You have two pairs of gloves. These are nitrile gloves. Please make sure you are wearing gloves and additional personal protective equipment if you have it before you start any resuscitative efforts. We have two pairs of gloves for that purpose. We have a disposable razor. This is for excessive chest hair. I would encourage you not to look at someone's chest and decide that it needs to be shaved. Real AED pads are extremely sticky, so go ahead and put them on even if they do have a hairy chest. If you need to shave the chest, you will know that because the unit will say press pads firmly to patient's chest. So we would keep pushing these pads down. If it keeps giving you that prompt of press pads firmly to patient's bare chest, you would need to then take the pads off. You could take this razor out, simply knock the hair out of the two spots where you need to put the pads. If you've taken the pads off gently, you put them back on. We have a large towel here. If you happen to get someone out of a swimming pool or if they're extremely sweaty, simply use this to dry their chest off. That doesn't have to be dried off 100%. Just get the major amount of water or sweat out of the way so you can put your pads on. When you are placing pads, this is an implantable cardioverter defibrillator and pacemaker. So this is what you would see up under someone's chest, either on the right or the left side of their chest, depending on where the electrophysiologist placed the device. But up under their skin, you would see a lump. You don't want to place the AED pad directly over this device, so you need to place it a little bit to the right or a little bit to the left. So any lump you see up under the skin, again, don't place the pad directly over it, a little bit to the right or a little bit to the left. Question sometimes comes up as well, can you use an AED with a pacemaker? You can. It's important to understand, and we won't spend a lot of time going into the processes of these devices, but a pacemaker has nothing to do with being in cardiac arrest. A pacemaker simply keeps your heart beating at the appropriate rate, so people who have a pacemaker in place have a slower heart rate than normal, so their heart needs to be paced at a higher rate. So don't worry about using an AED with a pacemaker or implantable cardioverter defibrillator. The last thing I'll show you is a pocket mask. These are used in your CPR training program if you've been through one or if you're familiar with using it outside of a program. But this is pretty easy to use. You simply deploy this up from the bottom into a mask. The small part would go over the nose, large part at the bottom of the mouth, and we have a one-way valve here that keeps the victim's exhaled air from coming back in your face. So we would simply breathe through this port, and this takes the place of you having to do mouth-to-mouth.
To initiate infant-child defibrillation, insert the infant-child key. To start the defibrillator, press the green on-off button and follow the HeartStart FRX's voice instructions.
Infant child mode. Remove clothes from patient's chest. When patient's chest is bare, open gray plastic case and peel off white adhesive pads. Look carefully at the pictures on the infant child key. Peel one white pad from the gray case. Place pad in center of child's chest. Press firmly to bare skin. When the first pad is in place, peel the second pad. Place pad on child's back. Press firmly to bare skin. Stay clear of patient. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. Shock advised. Stay clear of patient. Press the flashing orange button now. Deliver shock now. Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button. Place the heel of one hand in the center of the chest, between the nipples. For patients less than 1 year old, use 2 fingers instead of the heel of your hand. Push the chest down firmly. Keep time with the beat. Pinch nose, tilt head, and give 2 small breaths. Breathe. Breathe. Continue with compressions. Keep time with the beat.
CPR should continue to be performed according to standard protocol.